Critical Incident Stress Management, Capt 117, Part 1. Introduction. Critical Incident Stress, CS, is not a new concept, as the reactions to traumatic stress have been recorded for centuries and usually associated with warfare. You may have heard the terms shell shock, nervous shock, combat fatigue, and post-traumatic stress disorder, PTSD, applied to veterans who suffered emotionally after being exposed to the atrocities of war. Critical incident stress is a term given to us by the paramilitary and public safety agencies describing what may happen to emergency services workers who are exposed to trauma away from the battlefield. It can certainly be argued that our experiences within Civil Air Patrol, in our search and rescue and disaster relief operations, can mimic some of the traumas of war on our own home front. It is because we may be exposed to those types of horrific sights, sounds, smells, and experiences, especially in light of September 11th, that we need to be prepared for their after effects. Critical Incident Stress Management, CISM, is a comprehensive, multifaceted, systematic approach to dealing with the emotional aftermath of trauma. Civil Air Patrol has adopted the International Critical Incident Stress Foundation, ICISF, model, formerly known as the Mitchell model of crisis intervention. While it is solidly based on accepted psychological theory regarding psychotraumatology, psychological trauma, it is not psychotherapy. It is an organized way for members to get together in a safe and structured environment to share their common experiences, which will be discussed later in greater detail. In 1998, the Civil Air Patrol National Board recognized CISM after its introduction by Col. William S. Charles of Michigan Wing. At that same conference, CISM was presented in seminar for the first time by a paramedic/RN from Michigan Wing who had formed and trained CAP's first CISM team in 1997. The board's recognition of CISM as the standard of care for emergency services workers resulted in the formulation of a plan to integrate the program into Civil Air Patrol emergency services nationally. That plan was released to the membership in 2001 as the CPR 60-5. The following pages will help you to understand the core elements of CISM, the crisis intervention services offered through Civil Air Patrol, and how they are applied within the organization. You will also learn about the tools and resources through the CISM program that are available to you both as a senior member and cadet. Definitions. In Civil Air Patrol, we commonly use many acronyms, words formed from the initials or other parts of several words. When we spout them off rapidly in the presence of civilians, very often those who don't share our training will not understand what we're trying to tell them, as though we're speaking another language. In the field of CISM, there are acronyms and words that are not commonly understood, so the following list of many frequently used terms will help in your understanding of CISM. Stressor, the stimulus that causes the stress response. Stress response, the body's response to demand, a combination of neurologic and endocrine arousal response mechanisms that can affect and alter any organ in the human body. Stress also accelerates the aging process, wear and tear on the body. Critical incident, an event acting as a turning point with impact sufficient enough to overwhelm the usually effective coping skills of an individual. It is usually sudden, powerful, and outside the range of normal human experience. Critical incident stress, CSCIS, is characterized by a wide range of emotional, physical, cognitive, and behavioral signs and symptoms in response to a crisis event. Crisis, a disruption in a person's psychological balance. Their normal coping mechanisms have failed, and there is evidence of distress and functional impairment. Crisis intervention, a psychological band-aid to stabilize, reduce symptoms, return the member to a functional capacity, or refer them to a higher level of care. Critical Incident Stress Debriefing, CISD, a group meeting about a critical incident designed to mitigate the event's impact and to assist the personnel involved in recovering from the stress associated with the event. It is peer-driven and clinician-guided. Defusing, a shortened version of the debriefing, It is provided within 8 hours of an incident, conducted by peers, and may eliminate the need for a formal debriefing. Demobilization. Reserved for large-scale incidents and disasters, it is designed to assess the well-being of the membership, reduce the impact of the event, offer stress management information, and provide an opportunity for rest and refreshments before the member is dismissed or returned to duty. Crisis Management Briefing (CMB) large group intervention lasting 45 to 75 minutes for up to 300 people at a time. It may be thought of as a type of town meeting and is also used to triage individuals in determining the need for more extensive intervention. International Critical Incident Stress Foundation, ICISF, a nonprofit, non-governmental open membership foundation dedicated to the prevention and mitigation of disabling stress. CEEP /www.icisf.org/ for further information. CS Team Coordinator, CSDC Manager of the CAP-CISM teams at the region or wing level who coordinates the daily operations of the teams in conjunction with the mental health professionals. The CISM program is functionally under operations. Mental health professionals, MHP, people who hold advanced degrees, master's or doctorate, in a mental health field such as psychologists, psychiatrists, and social workers. CSD Chief, AMHP, trained to the advanced standards of the ICISF and specially trained in stress, PTSD, crisis intervention, and CISM, etc. Peers, any adult member involved in emergency services, pilots, ground team members, etc., that have been selected and specifically trained in ICISF-CISM. Critical Incident Stress Management. CISM is a combination of numerous functions that are ongoing before, during, and after missions that are available to CAP members. Some of them are noted as follows. Pre-crisis planning and education, on-scene support services, one-on-one interventions, debriefing, CISD, defusing, demobilization, crisis management briefings, family support services. Pre-crisis planning and education involves preparing for the possibility of adverse emotional responses to our search and rescue operations. It includes forming a team and/or making contacts with local non-CAP-CISM teams that are trained in the ICISF model of crisis intervention. Educational materials are distributed to the members through handouts, email distributions, and personal teachings in the classroom setting and during SAR/DR training. Pre-incident education and crisis anticipation has proved to reduce the negative effects of traumatic experiences and improve coping. On-scene support services may be as simple as an assigned CIS team member pouring someone a cup of coffee. They're inconspicuous and helpful in whatever needs to be done. They are the trained eyes and ears of the MHP who oversees them to watch for someone who may be having an especially rough time, and they may discreetly ask that person how they are doing and offer support. If the scene is especially gruesome, they may be calling in extra staff to handle the needs of the ES teams. They do not interfere with the IC or the mission itself. You may very often see chaplains in this role. One-on-one interventions are simply that, one person talking to another. It is used for individuals in crisis to mitigate the acute effects of the situation, restore the member to function, or refer them to a higher level of care, medical, psychological, etc. Debriefings are the most lengthy and formal of the interventions, lasting about 2 to 3 hours. The participants of the group are seated in a circle, in a room free of distraction. It is not an operational critique, only the feelings and experiences of the members present are discussed, and the meeting is highly confidential. Nothing that is said in the room leaves the room, and people may or may not speak as they choose, but when they do, may only share their own feelings and not speak for anyone else. All pagers and cell phones are off, only the members of the mission are present, and all members are equal, no rank or grade, and uniforms are off or grade insignia removed. There is at least one MHP present and an appropriate number of peers, depending on the size of the group. The MHP leads the members through a 7-stage process of structured group discussion: introduction, fact, thought, reaction, symptom, teaching, and reentry. There will be follow-up with members as needed, and the debriefers debrief themselves afterward. Defusings are a shortened version of a debriefing, lasting 20 to 45 minutes and must be held within 8 hours of the incident. 1 to 2 hours is preferable. The groups usually have 6 to 8 participants, and the defusing works with only 3 stages as opposed to the 7 for CSD: introduction, exploration, and information. Like CSD, a defusing is an early intervention strategy that is activated while the traumatic memories are more successfully dealt with before they are cemented in and perhaps distorted. Additionally, CSD and defusings provide a structure whereby the members may support and encourage each other, exchange information, and enjoy a sense of group caring. The group also provides a forum whereby the myth of uniqueness is dispelled, as many of the members will express similar feelings. Demobilizations are reserved for large-scale incidents, usually involving over 100 people. When the duty day has come to a close and the members are preparing to outprocess to their billeting or home, the demobilization site is their last stop. In a quiet place, the members will meet with a CSD member, not necessarily a MHP, and receive about 10 minutes worth of information and education. The members will then spend about 20 minutes in an adjoining room having light refreshments and relaxing before leaving the duty site. Handouts are utilized to reference the information given, and there may or may not be a formal debriefing following. The demobilization is an excellent tool to triage members to see if any additional interventions are needed. Crisis management briefings are also large-scale crisis interventions. They are usually held for large groups, up to 300 members at a time, after acts of terrorism, mass disasters, school/community-related incidents, and large military groups. It is less commonly used, but an effective tool when needed. It lasts about 45 to 75 minutes and provides information and rumor control about the crisis. A 4-step process is engaged to also reduce the sense of chaos, provide information about resources, assess the group for additional needs, help to restore the group to adaptive functioning, and facilitate follow-up care. A community leader or allied representative associated with the crisis may be on hand with the CIS team member to facilitate information dissemination. If there is a healthcare professional on the team, she may be the ideal choice to discuss the most common reactions relevant to the particular crisis experienced. Family support services involve assisting the affected family with their particular and specific needs during and following a crisis. They may not be included in debriefings, but we can show support by helping with their activities of daily living, making arrangements for them, including phone calls, and contacting family to come sit with them, etc. This particular service is well known to the chaplaincy and is best served by a CISM-trained chaplain who will be dispatched through the team CSDC. The chaplain can also mitigate a crisis of faith using spiritual tools to help the family through the recovery process. Critical incidents. You've been given some history, understand the commonly used terminology, and know the interventions available to you as a Civil Air Patrol member. But when do you consider calling in a CS team and why? If the situation is especially impacting and the members involved are psychologically and/or emotionally disrupted, there is usually evidence of that disequilibrium. Some of the reactions you may see follow. Physical: nausea, fatigue, rapid heartbeat, difficulty breathing, chest pain, and headache. Be advised that any of these symptoms may indicate the need for medical evaluation. Emotional: anxiety, guilt, denial, fear, depression, panic, irritability, apprehension. Cognitive: memory problems, poor attention span, keep replaying the incident, sleep problems, flashbacks, poor problem solving, not wanting to make a decision. Behavioral: restlessness, avoidance, change in speech or appetite, blaming others, pacing, increased use of alcohol or cigarettes, antisocial acts, withdrawal, easily startled. What type of situation is considered a critical incident and may cause these symptoms? There are many. Some are obvious, some may seem insignificant to one person, but horrible to another. It is all individually perceived, and there is no clear answer as to what causes the reactions. Still, coping skills are more developed in older than younger, in female than male. Why? One reason is because females have learned to talk it out instead of keeping things bottled inside. Some examples of critical incidents follow. Mass disasters, flood, fire, tornado, terrorism, weapons of mass destruction, multiple injuries/fatalities, death or injury to a child, serious injury or line of duty death, prolonged SAR time, excessive media attention, outsiders or family members interfering with operations, victim known to the members, any incident grotesque by sight, smell, or other circumstance likely to produce an emotional memory input. Now you know who, what, where, when, and why. So, how do you get help? The CISM teams are regionally mandated and managed throughout Civil Air Patrol. Each wing may or may not have their own team, but have procedures in place to find a team if they don't have their own. Any member may request intervention. If you are in a mission, talk to the IC. If you are in a squadron, talk to your squadron commander. They will pass along the request to the wing commander, who will contact the appropriate CSDC at wing or region. The situation will be discussed, and it will be determined what kind of intervention is appropriate. All of these discussions are completely confidential. When the intervention, debriefing, defusing, demobilization one-on-one is complete, the CSDC or MHP will make a local referral for professional follow-up care if it is needed. If no further intervention is warranted, the CS team representative will discreetly follow up with the members at a later date to see how everyone is doing. The activity is reported simply as having occurred by naming the place, time, and how many CS team members and participants were present. None of the discussion during an intervention is ever revealed. Becoming active on a CIS team. Any member of Civil Air Patrol may take the ICISF Basic CISM course and apply for membership on a CAPCS team. Each wing/region may have specific requirements about team application, membership, and training, so it is best to consult them about what may be available. They are the final authority, in accordance with the CPR 60-5 on their team members, who are handpicked and held at a very high standard. Civil Air Patrol does not pay for this training, so it is up to each individual to avail themselves of the courses. Basic CISM is only the beginning, as it is advised that the team members also take other peer support and crisis intervention courses. Members are also encouraged to join local CISM teams as civilians to remain current in training and experience. It is highly recommended that members take this training for their own edification, even if they are not sure whether or not they want to become active with a CS team. There are members who have taken the training only to find their desire is to work in a supporting role instead of becoming a debriefer. They contribute greatly as support staff. Others find that once they take part in a debriefing to assist their fellow members through a difficult time, they become hooked and make CISM their CAP career goal. Either way, Civil Air Patrol has included this program because they realize that the greatest asset is Civil Air Patrol is not the equipment or the planes, it is the members. We're here to take care of one another in one of the most important and supportive ways possible through CISM.